Elect as Mwingi West. Majority Leader, you may now move the bill.
Thank you, Honorable Speaker. Honorable Speaker, before I move, let me also take this opportunity to welcome all those students who have come to join us, including those from Embakasi East. I noticed the Member of Parliament, the Honorable Babu Owino, was banging the table instead of foot thumping. And I just pointed it out to him that he should foot thump, not bang tables. Honorable Speaker, now beg to move that the Digital Health Bill, National Assembly Bill number 57 of 2023, be now read for the second time. Honorable Speaker, allow me to begin by thanking the Departmental Committee on Health for tabling the very comprehensive report that they have done in a timely manner, having undertaken thorough public participation during the recess. And let me particularly thank them because they did this work at a time when the House was on a working recess and many other members were back in their constituencies, but they sacrificed time to be able to engage with members of the public and all Kenyans, including institutions that are in the health space, to be able to listen to their views and adopt those views in the compilation of their report. And under the able leadership of the Chair, Honorable Pukose, we thank you on behalf of the House. Honorable Speaker, our nation has made significant strides towards digital transformation in various sectors, leveraging on technology to enhance the implementation and delivery of services and products within the digital space, Honorable Speaker. Key among these innovations and transformation, Honorable Speaker, in the digital space, in the financial sector, Honorable Speaker, the most recent, besides M-Pesa, has been the Hustler Fund, where people now are able to access money by simply dialing on their phones without having to fill out papers, without having to know anybody. And Honorable Speaker, the health sector has not been left behind and indeed has made very steady progress in digital technology, transformation through implementation of digital solutions to manage, share, and use health data. Honorable Speaker, members will appreciate products like MTBA. I have seen a number of pharmacies around the country that are using solutions, digital solutions, to be able to provide and deliver pharmaceutical products to their clients, both consumers or patients and hospitals, and also other dispensers of pharmaceutical products. However, Honorable Speaker, the adoption of technology has been very uncoordinated, characterized by a fragmented implementation with health sector actors not adhering to basic digital health standards, guidelines, recommendations, and digital development principles, Honorable Speaker. These technologies have affected how health data is therefore managed, resulting in multiple disparate systems that have limited ability to exchange data. And the primary object of this bill, Honorable Speaker, or rather this bill seeks to now provide a framework for the provision of digital health services, to establish a digital health agency, to establish a comprehensive integrated digital health information system, and also to provide for data governance and protection of personal health information in the service delivery through digital health interventions on e-waste disposal and also on health tourism. And Honorable Speaker, members, you'll see from clause 5 all the way to part 2, actually almost the entire part 2 of the bill speaks to the establishment of this health agency, which, Honorable Speaker, from clause 6, members, see the agency will be established as a body corporate and will develop and operationalize and maintain the comprehensive integrated health information system to manage the core digital systems and the infrastructure required for its seamless health information exchange. It will also develop and implement the infrastructure for health data exchange of health information in a secured manner. It will undertake resource mobilization for implementation of health digitization in the country. This agency, Honorable Speaker, will also certify digital health solutions based on best practices and standards to ensure that all the solutions, digital solutions that are being used in the country, Honorable Speaker, are indeed solutions that are certified. It also, Honorable Speaker, amongst other objectives and functions that are stipulated in the entire of that clause, advise the Cabinet Secretary on matters related to digital health. Honorable Speaker, the bill further sets the minimum standards applicable for the establishment and maintenance of digital health information systems. It provides for the mechanism for interconnectivity between each county information system and the national system. Because, Honorable Speaker, under this comprehensive integrated digital health information system, all our health facilities, right from the primary healthcare facilities at level dispensaries, those at level 3, level 4, level 5, level 6, to the national referral hospitals like Kenyatta, MTRH, KURTH in Kiambu County, Honorable Speaker, will be integrated in one seamless system, and exchange of medical information will become easy. And therefore, Honorable Speaker, if you have a CT scan done on you in Kisumu, at the Kisumu Referral Hospital, a doctor in Kenyatta National Hospital or in Nairobi Hospital can be able to access that scan and be able to advise the person treating you down at the Kisumu Referral Hospital, or indeed a level 3 hospital in Marsabit County, Honorable Speaker. You will not necessarily require to have all manner of consultants scattered around the country, and therefore health personnel will be able to benefit from more experienced personnel at the national level or in our national referral hospitals through exchange of such data, Honorable Speaker, in a system that is seamless and that is secure, and where patient's data, Honorable Speaker, is safeguarded, and you are certain that your data as a patient is not subject to abuse or to be misused by characters out there. Honorable Speaker, this bill also seeks to facilitate the realization of the right to protection of personal information as guaranteed under Article 31 of the Constitution of Kenya 2010 and under the Data Protection Act number 24, 2019. Honorable Speaker, members are aware that the enactment of the Data Protection Act of 2019 presented very new challenges for the health sector in Kenya, as the sector handles very sensitive patient data whose protection requires more safeguards. And therefore, this bill fills that gap to ensure that patient data is indeed safeguarded. Because, Honorable Speaker and members of Parliament, Honorable Speaker, in the past have been victims where their patient data has been leaked to people who should not be holding private or otherwise very confidential patient data. And therefore, with this new bill, Honorable Speaker, nobody, be you a member of Parliament or any Kenyan who is attended at a health sector facility anywhere within the country, should be apprehensive or afraid that their patient data will be accessed by people who have no right to access that data. Honorable Speaker, the bill also enhances the health data governance framework in the country by requiring all healthcare providers and health facilities to adopt mechanisms to ensure the safety and security of patient information, Honorable Speaker, as I have articulated before, that Kenyans now will have the ability to have more control over their personal data, particularly in health facilities, because they will now be required to give consent before the collection, processing, and sharing of their personal health-related information. Therefore, Honorable Speaker, with the adoption of this bill, Honorable Speaker, nobody has to fear that any data that is collected from you will be shared without your consent. You must give consent for your data to be collected, for that data to be shared with anybody, even if it is another referral hospital or another health professional. It must be shared with your consent. And I must thank the committee, because they are indeed very emphatic, and I have seen from the report, as they engage with stakeholders to ensure that data protection for patients is very well safeguarded. And therefore, this bill, Honorable Speaker, besides what is provided for in the Data Commissioner's Data Protection Act, Honorable Speaker, this bill provides further safeguards on more railguards to ring-fence data that is coming from the health sector. Honorable Speaker, the bill further regulates the processing of health data, and in particular the health data that contains sensitive personal data through technological mediums such as telemedicine. In this regard, Honorable Speaker, the bill requires healthcare providers and technology platforms that offer telemedicine to put in place several safeguards, including anonymization and de-identification of sensitive personal data. Honorable Speaker, what this de-anonymization and de-identification means is that you'll be able to transfer data or share data in an anonymous manner or without clearly identifying whose data is. Therefore, Honorable Junaid, because I see him holding his chin, must not worry that anybody will share his health information if he's treated at a health facility in Migori. And that health facility requires referral services from his consultant doctors, be it in London or in Nairobi Hospital. And I know the Honorable Junaid is seen by a doctor who sees me also at the Kenyatta National Hospital Doctors Plaza. Therefore, I'm only using him as an example when I mention London, although I know he likes traveling to London, Honorable Speaker. But I was saying he needs not to be apprehensive that your data, whether you attended at the Suna sub-county dispensary, if that dispensary needs to share your health data with a consultant in Kenyatta National Hospital, that data must be de-identified and done in anonymous manner such that the person will be treating a patient, and because they can't see that patient, they will not need to know necessarily that patient is one Junaid Mohammed or one Kimani Ichungwa being treated in Olusigeti Sub-County Hospital in Kikuyu, in Nachu Ward. Honorable Speaker, the health agency, Honorable Speaker, as I said, shall among other things develop and operationalize and maintain this comprehensive integrated management information system that is established under part 4. Part 4 of the bill, Honorable Speaker. And this integrated management information system will ensure that we have a means through which we can manage the core digital systems and infrastructure required for the seamless sharing of health information and exchange of health information. Honorable Speaker. Honorable Speaker, I had promised the chair of the Health Committee that I will not take a long time in moving, but Honorable Speaker, it is just for us to appreciate that we are in a digital economy, we are in a digital world, and digitization is here with us. Honorable Speaker, you remember, members, you remember His Excellency the President committing during the campaigns to leverage on technology to be able to offer more efficient service delivery to the people of Kenya. And not just in the financial services sector as we did under the Hustler Fund, not only through the eCitizen platform where Kenyans now can be able to access over 5,000 services, government services online, but also now in our healthcare space, Honorable Speaker, that Kenyans will be able to access affordable, easy to access medical care from any part of the country, Honorable Speaker. And it will not matter anymore, Honorable Speaker, whether you are in the far corners of Kathiani constituency or in far-flung counties in the north of Kenya, probably in Elwak, where maybe the senior-most medical personnel you have there could be a clinical officer. And in some cases, Honorable Speaker, there are areas where dispensaries are actually managed not by clinical officers, by senior nursing officers. Honorable Speaker, Kenyans now will not need to worry that you are in a far-flung county, you do not have the resources to be able to access expensive health care in Nairobi Hospital, in Kenyatta National Hospital with seasoned consultants. But at your local dispensary, through sharing of information in a seamless and secure digital system, your health consultant or your health personnel at the local level can share that with experienced health personnel in referral hospitals, and you get the correct diagnosis of diseases, you get the correct treatment, and in a timely basis, Honorable Speaker, so that Kenyans do not have to live with the agony and anguish that many Kenyans have had to bear with. especially with diseases, Honorable Speaker, like cancer, which if arrested early, will not progress to become so agonizing to the patient and families across the country. Honorable Speaker, I do want to move that with those very many remarks, Honorable Speaker, that I beg to move, urge members to support this bill, because these health bills are in the best interest, as the Honorable Junet was alluding to when he seconded me on the procedural motion, that these health bills are indeed critical for our nation and for our people. It is up to us to be able to scrutinize this bill and the others and vote in their favor, not for the government, but to vote for the people who we know are suffering because of a dysfunctional healthcare system that we can now fix, and we have that golden opportunity, Honorable Speaker. As I move and request the Chair of the Health Committee, the one and only Dr. Pokose, to second.
Dr. Bukose.
Honorable Speaker, I beg to second. Honorable Speaker, allow me to thank your office and the office of